having selected a particular insurance plan, how does someone then maximize their benefits? How do you figure out not just the insurance benefit that your employer provides, but all the other richness of programs?
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management for Professionals. Today, we are virtually on the West Coast with San Francisco-based Castlight Health. Our guest today is Dr. Dena Bravata, Chief Medical Officer for Castlight Health, and also Senior Affiliate, Stanford Center for Primary Care and Outcomes Research. Welcome to the Business of Healthcare podcast, Dena.
Thank you. It's a great pleasure to be here.
Well, Dena, I've been following Castlight Health for over 10 years, and I've seen the company graduate beyond the category of a Silicon Valley startup. And my goal today is for you to share with our audience the value of Castlight, what you've created here with its care navigation platform, and how that can personally impact our decision making. But first, in order to set the stage, I want to establish a foundation for some of the problems we encounter as consumers of healthcare and expose the cognitive burden and decision fatigue we experience in making healthcare choices. So let's start with insurance. According to the Kaiser Family Foundation, 150 million people get insurance from their employers, and that's roughly 49% of the U.S. population. And then Medicare and Medicaid represents another 38%, with about 9% still uninsured. With respect to insurance, where does Castlight shine their light?
Yeah, great question. So clearly, Castlight is working mostly with commercially insured populations. And so that means working with large self-insured employers who provide healthcare benefits for their employees. In addition, Castlight helps on the health plan side as well, as those entities are providing tools and services to their fully insured customers, and also to the self-insured employers for whom they provide third-party administration services. So this is really, Castlight serves the wide array of commercially insured populations.
Okay, well, that makes sense. So your whole plan here is to connect members with these quality providers, then a navigation platform that allows you to do that. We'll talk more about navigation in detail, but I think it's good for people to understand that with respect to Castlight, think about your employer. Think about the benefits that you get from your employer. And I come from industry, and I've worked for some very large employers, and every year, just about once a year during open enrollment, we'd have deadlines to choose our insurance options. And talk about cognitive burden and decision fatigue. I love those words, by the way. Most of us just looked at the cost for the next year. We never looked at it on a multi-year basis. The decision points were typically just around premiums and deductibles and co-payments, out-of-pocket max, things like that. And most of the time, the employer could only do so much to help us understand these choices. Is that where Castlight fits into the equation?
Well, so I think you're really talking about plan selection, right? So if your employer offers perhaps an HMO or a PPO, which plan will you choose? And an often quoted statistic is that people spend more time choosing which car to buy than any of these decisions around which health plan they're going to select or which provider they're going to choose and so on. And frankly, I think it's because in many ways the tools for making those selections are a little easier. I think it's also that when you're choosing to buy a car, you might really understand what your own preferences are for, how important is it that it's a sports car and that it goes really fast or that it looks pretty or that it's in your price range. And I think that it is very hard for people to have that kind of information about what kind of healthcare do they need, even if they're someone with chronic conditions and so they've experienced a fair bit of healthcare in the past. So to answer your exact question, no, Castlight, it does not provide a health plan benefit selection tool. We come in kind of at the next step, having selected a particular insurance plan. How does someone then maximize their benefits? How do you figure out not just the insurance benefit that your employer provides, but all the other richness of programs? And I hope that we'll have a chance to talk a lot more about them, because navigation, 5 years ago really was around how do you get someone to go to the right doctor for them, or maybe to go to the right hospital for them. Today, navigation is much more than that, right? It's certainly about those things, but it's also around figuring out which of the dozens of free, often, or low cost options my employer has, or my health plan has made available to me.
Well, my experience with the employers has typically been that they're very interested in reducing some of the cost and improving the outcomes. And I worked for a company that had, 200,000 employees. They spent $3 billion a year on being self-insured. And they were looking at ways to address things like back pain and hypertension, smoking cessation, and some of the more basic things like nutrition and mental wellness, too. And they had limited resources for that. They needed help. They needed a navigator themselves to help kind of figure that out. And I think that what happens there is that the money set aside for these benefits, it can get eaten up in the compensation package as well. So, there's no money going out there. I'm trying to think in terms of Castlight that not only do you help navigate employers, but you also ultimately end up navigating their members, their employees. Is that right?
That's right. Right. So we provide technology and services, and I can talk a little bit about who those people are that are providing the services that help the individual member, the patient, and their family member navigate whatever the issue might be. So maybe we could talk about a few examples.
Okay.
So there may be just, a simple example of I need to find a doctor, right? So that's like a kind of a classic use case, if you will. And if you were to go to a standard, if you were to go to a health plan's website, or if you were to go to Google and look up, I need to find a primary care doctor in the Dallas area, you would get a static list. If you and I did that search, we would each see exactly the same set of search results. And yet clearly, I'm going to guess that like a primary care doctor for you might not be the best one for me, right? It may be that I have diabetes, or perhaps I suffer from depression. And so Castlight takes that into account by understanding, typically from claims, but from other sources as well, who is this person who's searching for a doctor, to then serve up a very specific curated list, even for something as simple as just finding a primary care doctor. And so therefore, the list that you and I would see would be quite different on the basis of that. Another example might be, so let's say I'm that same person with diabetes and depression. It may be that I need to see a psychotherapist. My situation has just gotten to be that bad. And there are free psychotherapy sessions available for me through my EAP, my employee assistance program. The vast majority of companies these days offer such programs, and there's free therapy involved. So how great for me to know about that, to be able to then understand which therapists in that employee assistance program might be a good choice for me. And if I need to have an ongoing relationship with them, are they also in my medical plan, so that I can then continue to see them in network, even once I have to sort of pay for them myself. So that would be an example of making sure that we serve up not just providers, but also programs.
Well, I know that everybody has their preference, and I think more people today are looking at quality. Quality as being a key indicator. And, some of the horrific statistics that we hear, We hear a lot about deaths that are due to healthcare errors. Like I think Leapfrog said 250,000 people every year die to errors that take place in healthcare. And so looking at quality, I mean, you hear about over 500,000 deaths with COVID in this country this year, and that's in the news every day. But you don't hear about the 250,000 deaths due to errors and the quality associated with that. And so when you find all this data to make recommendations for people, tell us about how you go about. Data has to be a very important part of what you do. What kind of data sources do you evaluate and create or curate? That's the word you like to use.
Yeah. So Castlight has been in the business of serving up both cost and quality information for people for the decade plus of its existence. And so you're asking a very important question, and one that has evolved over time and has been the subject of a great deal of investment and study on behalf of Castlight. Castlight curates dozens of data sources, and they include things like facility-based information. So which hospitals are particularly good at, for delivery of babies or surgical interventions, and so on. Quality measures that relate to individual providers, physicians, non-physicians, including psychotherapists, physical therapists, among others. The data fall into a bunch of categories. So some are things related to the actual outcome of interest, right? So if you're having heart bypass surgery, how good is this hospital at keeping you alive during your surgery, making sure that you don't have any complications from it? In other cases, it might be more related to process measures. So let's say you're a person with diabetes and you're going to see a doctor for that. How good is that doctor at making sure that all of their patients with diabetes are getting the guideline recommended care? So they're getting their blood tested, they're having their medications prescribed, all in guideline concordant ways. And then finally, we look at things like volume. So because Castlight has over 20 million eligible members, that's a lot of claims. So we can see even from our own claims and from other data sources that we curate, so which doctors take care of lots of patients like you and which ones take care of fewer? Because we know from the medical evidence, especially when it comes to things like surgeries, people who do a particular procedure all the time, practice makes perfect, and they do much better at that. So those are sort of some of the data sources that we curate, as you say, to being able to create what we've called a Q score. So this is kind of a proprietary way of ranking providers and facilities for very specific procedures. So Bob, let's say you were a cardiologist. You might be terrific at taking care of patients who had heart attacks, but maybe not as good at taking care of people with infections of the heart, right? And so you would have a different Q score on the basis of what is that particular need that an individual member might have. And we then match that to the member's specific needs. And so that's what we call best match. And, you used the phrase earlier, cognitive burden, showing people all this information about the quality and the cost it is an impossible task for people to try to parse that out and make a good decision. And so we have worked extremely hard and have iterated over time. We've done a ton of user testing to really figure out what is the most straightforward way to show quality information, ratings that are mostly about convenience with cost, so that people can make the best choice for themselves or their family members.
Okay, so that Q score, that Q stands for quality score then, okay?
That's right.
That makes good sense. And it sounds to me like you've standardized the quality data, and you've done that in a way with some type of a weighting system. So how do you know out of that quality, what's the important things? How do you go about saying that this person's better because of this or not as good because of that? You talk about a proprietary algorithm. I would like to be able to think that this is updated, the data is updated, and I can trust what you're saying. So how do you communicate that back to the member here, if you would?
That's right. It's a great question. And so I think there are a variety of ways different entities think about quality. And sometimes they're not very transparent about what is that weighting system? What's the data that's going into it? What is that weighting system to spit out this particular answer? It feels like more of a black box. And so we have tried to make that both, communicate it as easily as we can, because it is complicated, but at the same time, not have it just be a black box. So the weighting system, to answer your first question there, is that we weight the outcomes the highest, right? So if somebody is looking for an oncologist, which oncologists have the best outcomes? How many people, are they able to cure and save lives who have exactly that kind of condition? So outcomes is weighted the highest. The next is then these process measures, right? So again, if you're going to see a doctor for high blood pressure, how well does that doctor do at making sure that their patients with high blood pressure are having their blood pressure checked often enough? Are they getting their labs often enough? Are they on appropriate medication and taking those medications appropriately, and so on? So those are process measures, and those are weighted a little less than the outcome measures. And then we have convenience scores as well. So is this person someone who has been rated well in terms of having they're nearby, their office staff is has been rated to be polite, they're clean, and so on. And so that those kinds of what we would call tertiary measures are weighted the least. And one of the things that we do with some of our partners, so sometimes an employer or a health plan may say, well, I'd like to change your weighting system a little bit. I'd like to give a little more weight to some other measure. And because this is an algorithm that is, so we make public to our partners, we can do that tweaking so that it meets their particular needs.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
So ultimately, as a member, I could end up with somewhat of a personalized Q score that says, I'm trying to think how this affects the individual, how that person, we have all these people writing books about all the problems in healthcare. Dr. Marty McCary had The Price We Pay, and, Dr. Vivian Lee had The Long Fix, and they expose all these things. But this sounds like it gets down into actually making decision support for the individual. So are you picking out the doctor for me, or are you giving me a choice that's based off my personalized Q score?
That's right. Yeah. So very rarely would we be able to say there's one great doc for you, sir, right? Typically what we would say is, here are 5 clinicians who have an excellent Q score for exactly what you're searching for. And they have exceptional quality ratings. They're close to you. And then you might choose among them. Maybe one of them speaks your native language, or, maybe one of them is at a facility that you're accustomed to going to. So there may be some factors that we don't know about you that would make you want to see that person over someone else. so what we've done is we show classically just 5. And then if people want to see more, they can see like the entire list of in-network providers, what the cost and relative Q scores are for all of those folks.
Okay, so unlike Yelp or some type of restaurant guide where they tell you this is what people think about it, you also come up and you provide a quality indicator and also what the experience has been from a patient rating, and then also cost. So those 3 things probably help make a pretty good evaluation process for the normal person. And the big question I've always had is, how do you get patients to care enough about their health as the doctor cares about the health? How do you get people to really engage with this? Does it take a bad situation to take place where now they need to go out and get involved? How do you proactively get people involved with other things like nutrition and activity and rest and mental wellness? How do you get them motivated and engaged before there's a problem? Are you involved with that at all at Castlight?
Yes, absolutely. Well, I think, you're asking such an important question. Engagement has been a buzzword, and necessarily so, right? Because employers are providing services like Castlight and all these other, they're providing insurance and all these other tools, and yet often they go unused. And so I think figuring out how to engage someone begins with understanding that everybody has a different level of engagement. You're a marathon runner, right? I am not. You have a different level of interest in your own longevity and your emotional, physical, financial well-being than I do. And so I think the first thing is trying to, recognize that there is by no means a one-size-fits-all approach here. And let's use the best evidence that we have, collect as much data as we can about your behaviors and my behaviors to serve up information so that it's going to be relevant. So for you, you might be very interested in well-being related challenges, right? So Castlight serves as that kind of platform, everything from healthy eating, or perhaps we'll do a workplace walking intervention. I certainly hope to be on your team and not somebody else's, right? So I think there are many companies have made investments in well-being to really try to, keep people healthy, keep them engaged, make it fun. They often provide incentives for doing so. Those incentives take all kinds of shapes and forms. They may be sweepstakes, dollar amounts, and so on. So I think, on the well-being side, there's a lot that's being done. And, there's a fair bit of science coming largely out of the behavioral economics literature for how we can motivate you and how that's different than motivating me. When you have someone who has a chronic condition, the need to engage them and how they want to be engaged is very different, right? And there are these particular life moments when people are much more willing to change their behavior. So, a first-time pregnant lady, you have someone who has perhaps been gaining a bit of weight and they get a diagnosis of pre-diabetes or pre-hypertension. That is this real moment when we can intercede and say, look, if you adopt these simple, let's make it simple, stepwise behavior changes, you have an opportunity to avoid diabetes or avoid hypertension and so on. And then for people who have chronic conditions, motivating them to take their meds, do their self-management and so on. Each of those requires a completely different approach. And yes, Castlight is a leader in trying to think about the ways to do that.
Well, I can see there's no better time right now than needing a navigating coach, a navigator guide with I'm a big advocate for people, and I publicly say, go get your vaccine. It's the smartest thing you can do. And a lot of people don't know how or where to go. And so a navigating guide would be pretty handy along that line. Is Castlight directed in that as well?
Yes, Castlight has been doing a great deal of work around navigation during the pandemic. Your specific question is around vaccines, but if I might talk a little bit about kind of navigation during the pandemic more broadly. So, when it first started in March of 2020, what we saw in Castlight was that the first question that people were really seeking was, where do I get a COVID test? And so, I, for one, thought like, oh, surely the CDC will stand up a registry for where to get a COVID test. And it was not forthcoming. And so at Castlight, we took it upon ourselves to build what is, I think, without question, the most definitive COVID testing registry. So if you were to do a search on Google or Apple or health plans websites or about a dozen public health departments websites, all of those sites are powered by Castlight's data. We have a team. We've built a bunch of tools to make this more efficient, but we have a team of about 20 people who work every day to continue to maintain that testing registry, because even as vaccines become available, people still need to get tested. And so we were recognized for our excellence in having done a nice job on the COVID testing. And in the late fall of 2020, asked by CDC and their partner, Boston Children's Hospital, to help with the last mile of COVID vaccine inventory management and navigation. So in the fall, we built a provider portal that every provider in the United States who is a COVID vaccine provider through CDC comes in on a nightly basis and updates how much inventory they have available. We've built a reporting portal back to CDC so that they know at a glance where is all of the vaccine in the United States. And that data set powers vaccinefinder.org. So vaccinefinder.org is a site that's been up for about a decade. It's run by Boston Children's Hospital in collaboration with CDC, and historically has been used to help people navigate where to get routine immunizations. Where should I go for my flu shot, my tetanus shot, and so on. But we have built for them their new COVID vaccine navigation tool, vaccinefinder.org. And that's been up and live for a little while, as states are now increasingly moving from only vaccinating restricted populations to general availability. They're then turning on wanting to show in Vaccine Finder where people can go in various states. Castlight uses that same data internally for our own tools and services, so that we provide members with educational information about, the safety and efficacy of the various vaccines, what to expect when they're going to get a vaccine, answer common questions about that, in addition to a little chatbot that helps them identify where they can go. Never has there been, a more pressing healthcare navigation need than where people can get care, during this crazy time.
Well, it sounds like the foundation for Castlight is in the data that you acquire, that you curate. Not only that you curate, but that you also have a way of customizing that so it's meaningful, and how you go about communicating it. And, data is becoming a very popular topic. Recently in the news, in our classes there at UT Dallas, we've got a course on health information management technology we just completed, and we learned about a new company in the news called Curate, and Curate is based out in California there, and they're trying to gather data from all these different health plans, et cetera. And I see that the secret to success in the healthcare industry today is what exactly you're doing with the data. And I can see that you're trying to create a culture of health, and you're trying to get people engaged, really supercharge their engagement, and ultimately reduce the medical cost. That's the greatest thing. I know you've got a white paper out recently, and I definitely hope that we post a link to that with this podcast, but it's Castlight's Approach to Quality, and it's well written. I hope our audience will download that and review it. It's got a lot of valuable information in general. This has been a very interesting conversation. We're so fortunate to have you share with us the message. Don't go alone. You really need to have navigation help here on this journey to health. And so it's great to have Castlight on our podcast today, and we look forward to following you into the future and see the developments that take place, because I think the journey is just in the first of its decades of service to us. So thank you again for being part of the Business of Healthcare podcast today.
Thank you. It was a real pleasure. Very fun to talk to you.
Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode links, notes, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jundal.utdallas.edu and then search under the Center and Institutes tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z. And let us know how we're doing. I'm your host, Dr. Bob Kaiser, with the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.